World, as we said, mourning Queen Elizabeth II, Britain's longest reigning monarch, who died yesterday. Members of the royal family rushed to her side after her health took a turn for the worse. Joining us now to talk about that is our health expert, Dr. Payal Kohli. Talk more about the history of the Queen's health. Good morning.
Good morning, Gary.
She was 96 years old, so she did have a good life, that's for sure. So what do we know about her health, last few years especially?
You know, at the age of 96, she was actually remarkably healthy. We know that she was in the hospital about a year ago in October of 2021. We don't know why, but she just spent one night in the hospital. But actually before that, she wasn't in the hospital for 8 years at the age of 77 when she had a stomach bug. So she was essentially getting into the hospital about once every decade or so for knee surgery in her 60s and then 70s for the stomach bug, 80s for this unclear cause. But we do know that she had a great team of medical doctors around her, and that's called the medical household when it comes to the royals. And these are general practitioners that have been picked from the community. They're extremely tight-lipped in general about what's going on, but their job is to keep the Queen healthy, which she really was.
Yeah, well, that's good. I mean, we could all, do that, hopefully. She did have COVID earlier this year. Do you know how she came through that?
She did. So it was in February of this year. And in fact, after COVID, she often said publicly that she was left feeling very tired and exhausted. Now, I don't know if she had long COVID or if she just took a long time to recover, because at the age of 96, any kind of infection, even a cold, can knock you off your feet. We know in the past she's struggled with colds as well. But we do know that after COVID, she had some issues with mobility. She was actually walking more with a cane than she had been before at public events.
Well, monarchs don't always lead the healthiest lifestyle, I guess. So what do you know about the Queen's lifestyle?
Yeah, actually, she changed the rules when it came to how monarchs live, because before that it was alcohol, eating a lot, but she did the opposite. She didn't smoke. She ate and drank in moderation. She was extremely active. In fact, she would walk her dogs regularly. She was horseback riding until very recently. She would have garden parties.
Wow.
So she was very, very socially active and physically active.
Yep, and she was very sharp right to the end. I mean, she met with the Prime Minister 2 days ago, and so she must have kept her mind active too.
She did, and that was what was remarkable about her. At the age of 96, she was still looking at parliamentary proceedings. She was still involved in many of the political briefings, and doctors often joke that there's a secret in medicine. The way to keep your brain sharp is to keep working.
Right.
And we just had a report come out about the longest working doctor. He retired at 100. He was a neurologist. And so I think that was part of her secret, was to keeping herself sharp, was to just keep doing what she loved.
Yeah, I mean, she could have turned this all over to Charles 20 years ago, but she chose not to. She chose to keep working, and so, that is something.
Can we convince you to keep working?
Yeah, probably not. But thank you very much. Dr. Payal Kohli, we appreciate it.